There you go.
There we go.
That'll get it. All right. Good morning, everyone. Welcome to LNO. It's 9 o'clock. We'll get started. Before the clerk calls the roll, so we don't have another incident like last week, if you're here to sign up for or against a bill, I need you to do that right now because we're going to take that list up as soon as the clerk finishes calling the roll. So if you're here to sign up for or against, make sure you go back to where Tuna's standing right now and sign up. We'll collect that here in just a minute. All right, clerk, please call the roll.
Representative Banta.
Present.
Representative Bratcher.
Here.
Representative Callaway.
Present.
Representative Kleins.
Here.
Representative Dixon. Representative Pfister. Representative Flannery. Representative Gentry. Representative Hevron. Representative Herron. Representative Huff.
Here.
Representative Jackson.
Present.
Representative Kulkarni.
Present.
Representative Meredith.
Yes, ma'am.
Representative Neighbors.
Here.
Representative Palumbo.
Here.
Representative Pratt. Here. Representative Smith.
Here.
Representative Timoney. Chairman Cook.
I'm here. We have a quorum. We're duly constituted to do business. Going a little bit out of order this morning to do some requests. We've got Senator Meredith is going to start us off. So, sir, if you'll make your way to the table and hit the green light, and you and your guest introduce yourselves for the record, please.
Good morning. Green light does mean go, and I appreciate that very much. And always a pleasure to appear before your committee, Mr. Chair. This is a bill that was heard during the interim, and kind of unique in itself that it deals with some licensure standards. And usually folks come to us asking for standards to be less restrictive. This one's different. It requires it to be more restrictive, specific to podiatry. And this was an education for me when I was first approached by this. That, you know, most medical schools, that once you complete medical school, then you have to go into your residency program, and that's when you get a fully unrestricted license to practice your profession. Podiatry has been a little bit different in Kentucky, that once they complete their medical school training, they get a fully unrestricted license. Still, most do a residency program, but that's still a 2 or 3 year commitment. This group came to me and said, we want
Motion on the bill.
Okay, we have a motion on the bill. We have a second. Any questions or comments? Okay, clerk, please call the roll.
Representative Banta.
Yes.
Representative Bratcher.
Yes.
Representative Callaway.
Yes.
Representative Kleins.
Yes.
Representative Dixon. Yes. Representative Pfister. Representative Flannery.
yes.
Representative Gentry.
Yes.
Representative Hevron. Yes. Representative Herron. Representative Huff.
Yes.
Representative Jackson.
Yes, ma'am.
Representative Kulkarni.
Yes.
Representative Meredith.
Yes, ma'am.
Representative Neighbors.
Yes.
Representative Palumbo. Representative Pratt.
Yes.
Representative Smith.
Yes.
Representative Timoney. Chairman Cook.
I'm a yes. Motion passes. Same should pass on the House floor. Thank you very much, Senator Meredith.
Thank you, Mr. Chair. Appreciate the opportunity to present the bill. Thank you, committee.
Yes, sir. Okay, next let's go to Senate Bill 14. Senator Thomas, if you'll come forward. Representative Neighbors, I believe you're going to sit at the table with them as you'll be carrying it on the House side. If everyone could just, as you sit down before we start, if everyone could hit the green button and say your name and who you're with for the record.
Good morning, Chairman Cook and members of the committee. I'm ready to proceed whenever you are.
If you'll just have everybody before we start, if everybody could just go through and say their names and who they're with.
All right, I'll let them introduce themselves. Leanne, I'll start with you on my left.
My name is Leanna Wynn, owner of Leanna's Nail Academy. I'm a recently appointed board member for the Kentucky State Board of Cosmetology by the governor, but I will be speaking on my own behalf and representing myself and not speaking for the KBC today.
My name is Molida Sot. I am a licensed nail technician in Kentucky.
Okay.
Amy Neighbors, and I represent the 21st House District.
Thank you, Chairman Cook. And let me begin by saying that Senate Bill 14 goes back to the interim. Many of you were present back in June of last year when I first brought this issue to the attention of the legislature. And what you heard were many abuses and oppressive tactics being imposed upon nail technicians. And I was bringing my proposed Senate Bill 14 at that time to you to address and redress a number of those abusive conduct situations that they had encountered. During the evolution of Senate Bill 14, as it passed the Senate, there are 4 critical points I want to bring to your attention today that I ask for your support on. Number 1, that where there's an issue regarding a proposed or alleged violation in a nail technician area, unless the health, safety, and welfare of the Commonwealth is impacted, the board can issue a violation, but the nail technician facility has the right to immediately appeal that pursuant to Chapter 13B and seek an administrative hearing on that. They cannot be closed down unless it's a true emergency, and that matter has to go through the administrative process to determine whether that violation is legitimate or not. Number 2, and this may be number 1, the board is now prohibited from bringing direct criminal action against any member of the board. It's just not limited to nail technicians. It could be cosmetologists, estheticians, or alike. And this is very rare because, as I've said repeatedly, not even the Kentucky Bar Association can bring direct criminal actions against an attorney. We have a process here in America whereby if a person is going to be charged criminally, you have to go through either the county attorney's office or the Commonwealth attorney's office. We have a process for doing that, and having that particular institution vet the alleged crime, determine whether it is a crime, and bring that forward. The Board of Cosmetology is not unique on that. There are 3 other agencies that have that right, and as I've said already, I think over the interim, I'm going to file legislation to eliminate that altogether, but that has stricken. Number 3, we give the nail technicians a seat at the table. Senate Bill 14 gives them a voice. They're a member of the board, and so they will be present and have the opportunity to inject policy in the Board of Cosmetology going forward. And number 4, as indicated during the interim session, they have a problem with passing a test. Understandable, because English is not their native language. Their native language is Cambodian, Vietnamese, or others. And of course, being asked to take a written exam in a language that's not native to them is challenging. I mean, imagine us trying to take some kind of exam in Vietnamese and Cambodian, how challenging that would be. But that's what they're faced with. So the final provision in Senate Bill 14 says if they fail the exam, after 1 month, they can retake the exam, give them an opportunity again to have additional access to the exam, until they are able to master English sufficiently to pass the exam. That summarizes Senate Bill 14, and I ask for your approval, Chairman Cook and members of the committee.
One quick question on the test taking, can they just take it over and over and over again, or is there a limit to how many times they take the test? Okay. Representative Tom Odell Smith.
Yeah. First of all, thank you, Senator, for bringing this to our attention, because I've had some constituents in the past with this problem, and with some of our places in my community, and it wasn't as deep as abuse as it was that they were hindered from being able to do their profession. And so they did do this, and I appreciate you bringing some of this stuff. It was deja vu listening to some of it, because over the years I've heard some of these complaints, and a lot of our associations, it wouldn't hurt for a review of all of them, because in-house associations that deal with things in-house, sometimes we don't hear about it, but there's issues in there, and sometimes they're afraid to say anything because of retribution or something that would come back down on what they're trying to do for a livelihood. But thank you for bringing this to us.
Well, Representative Smith, I appreciate you saying that. It's very kind of you. And I will tell you this. It will be no surprise to me if I hear grievances alleged by other professions in the future. And if I do, I'm going to call on you first to say, will you join me in that effort? I'm going to remember that.
Well, I wasn't really looking for a job, but I'll be there. I will be. It is a concern of mine. I appreciate that because it is. And Mr. Chairman, I'm sorry to elaborate, but I hear this from other dental, the medical associations. All these different associations seem to have a lot of in-house deals that go on, and I think sometimes we need to protect our people that are working every day trying to do things right. So thank you, Mr. Chairman, for letting me elaborate.
Representative Flannery.
Thank you, Mr. Chairman. Senator, I want to thank you for bringing this, compliment you for bringing this. Of many issues that we heard in the interim on the committees that I served on, I probably had more feedback on this issue than any of them. This is an issue that I've had people in my area, constituents, contact me about. As a lawyer, I've experienced this. I really do believe this is an issue that needs to be addressed, and I thank you for bringing this.
Well, Representative Flannery, I appreciate that. And I will tell you, as I look at this committee, it's so nice to see so many of you who I've worked with in the past. You know, I may be in the Senate, but I'm no stranger to the House. And it's nice to have the opportunity to work with you more personally, one-on-one. So I appreciate you saying that. And Chairman Cook, I haven't allowed Representative Neighbors to say anything, so I want to give her the opportunity.
I tell you what, let's hold off. We've got a speaker in opposition, so let's do this. Let's clear the table. We'll let Julie Campbell come up from the Cosmetology Board, and then we'll bring you guys up here to finish out. How about that? Good morning. Just make sure the green light's on and introduce yourself for the record. I know you're no stranger to this committee, so welcome.
Good morning. Julie Campbell. I'm the Executive Director of the Board of Cosmetology at this time. And we are not necessarily in full opposition, but we do have some concern with a floor amendment that was placed on at the last moment regarding the callus graders for pedicures. I have looked into the situation that has been in regulation to restrict those since 2019, I believe, specifically named. And according to research and looking at other states, specifically, callus graders are prohibited in Alabama, California, Idaho, Indiana, Iowa, Minnesota, Missouri, Nevada, New Mexico, North Carolina, North Dakota, Oklahoma, South Carolina, Wisconsin, and that is specific to the grader devices. And all blades for callus removal are also prohibited in Alaska, Colorado, Delaware, Georgia, Kansas, Louisiana, Maine, Maryland, Massachusetts, Mississippi, New Hampshire, New Jersey, New York, Rhode Island, Washington, Wyoming. And Kentucky does currently have a regulatory restriction on the callus graders. They are a device that should only be wielded by a podiatrist, not by an individual with anywhere from 2.5 months or 450 hours of training to 9 months. And the reason for that is the most often used person who needs that callus removal is somebody that has either diagnosed or undiagnosed diabetes that can get a serious infection if those are wielded improperly because of the poor circulation in their extremities. And it can cause peripheral neuropathy that is common to them, and often it's many years before they're diagnosed as diabetic and therefore at risk. And it is the most often quoted risk or injury item that most boards of cosmetology do hear about across the country. So I would just like to speak that I think, and the board has clearly stated previously, that they feel like this is a very dangerous proposition to allow no restriction on grader devices for callus removal.
Thank you. Are there any questions on this part?
Mr. Chairman, can I clarify something real quick?
Yes, sir.
Can ladies not buy a device and do this at home?
Some can, yes,
So
but
you
wielded by
can-
a professional, that's a different angle.
Well,
There's
no,
different
I'm saying
depths.
so you can go to local pharmacy and purchase it, or Walmart, wherever.
Yes.
I'm not trying to promote any
Right.
business. Are we talking about the same thing? You just like on your heels, you just
Yes,
take off.
these
excess-
are they look, for lack of a better term, like a cheese grater.
Well, okay, I just want
And
to make
they're
sure we're
a
on
metal
the same-
device. Yeah, a
Yeah.
metal blade.
So anybody could do this at home.
Yes.
Okay, thank you.
Any other questions? Okay, let's move our original presenters back up, and
Thank you.
we'll let them wrap it up.
Chairman Cook, let me respond to that briefly. This was a friendly amendment brought by my counterpart in the Senate, Senator Julie Rocky Adams, and it passed unanimously. And I will tell you, I personally vetted this before it became a friendly amendment, and I heard from everyone, both patrons of nail technicians as well as nail technicians themselves, that there was nothing wrong with this. But I'm going to turn to one of the experts here, and I'm going to let Ms. Leanna Nguyen address that in a more professional manner.
So with the foot files, I know about the regulations where it's been banned in the state of Kentucky for quite a while now, but I feel like it handicaps the nail professionals from having a tool that they can professionally use on a client, which some clients actually enjoy. And if they don't want the tool, they can just tell the nail tech that they don't want that. I feel like you literally see these tools at Walmart, CVS, Walgreens that normal people can buy. So if a normal person can use it, why can't a nail professional use it? Just like how a barber can shave, they use sharp tools to shave the beard and everything. I just feel like it's making the jobs of all the nail techs in the state of Kentucky more difficult. As long as we use infection control practices to properly infect the tool, we should be able to use it. That's my thoughts on it.
Representative Klein, do you have a question, sir?
Yes, it's just a fee question for the written theory test. I'm going to assume there's a fee, and if there is, what is it?
The initial fee is $85 to take the test.
That's good. And then another.
Yes, sir.
And if they have to retake it, they pay the $85 again.
Yeah.
Correct?
Yes.
Okay, thank you.
Okay, any further questions or comments? We have a motion on the bill. Is there a second? We have a second. Clerk, please call the roll.
Representative Banto.
Yes.
Representative Bratcher.
Yes.
Representative Callaway.
Yes.
Representative Kleins.
Yes.
Representative Dixon.
Yes.
Representative Pfister. Representative Flannery.
Yes.
Representative Gentry.
Explain my vote, please.
Yes, sir.
I'm a yes today in regarding the floor amendment that went on. It is my opinion that we should be allowing that option for the customer. And if an infection did occur and it was at, for some reason, some fault of a nail technician, there is liability out there and avenues to be pursued. So I am definitely in favor of this. And also last June, I do remember the presentation, and I'd still like a 5-finger discount if I come to a nail technician. Thank you.
Representative Heverin. Representative Herron. Representative Huff.
Yes.
Representative Jackson.
Yes, ma'am.
Representative Kulkarni.
Yes.
Representative Meredith.
Can I explain my vote?
Yes, sir.
Senator Thomas, I told you the other day I was going to be a yes vote on this. I agree with the vast majority of this bill, and I appreciate what you're trying to do. I do have some concern with the callus grater issue. There's a reason that so many of these states have banned that practice,
And especially when we're talking about folks who have diabetes and could potentially get an infection there, I have some real concerns because I have seen folks who have gotten those infections, not necessarily from this practice, but from other things that have happened, and have lost toes, have lost feet, have lost parts of their legs because of those infections and because they're diabetic, their diabetes issues that they have. And so I have some concern with that issue, but I committed to vote yes, and I agree with most of the bill, and so I'm going to be a yes today.
Representative Neighbors.
Yes.
Representative Palumbo. Representative Pratt.
Yes.
Representative Smith.
Yes.
Representative Timoney. Chairman Cook.
Explain my vote. I hear what Ms. Campbell has to say, and I believe I'm going to vote yes on this today, but I believe some regulations can be put in place to ensure that the proper disinfecting protocols are taking place, maybe warnings are posted, whatever it needs to be done. This is not a practice that somebody has to have, that they're volunteering to have that, and if they choose to allow that to be done, I think we should allow it. But I think we just need, maybe could tighten it up with some regulations on that front. So congratulations, your bill passes. Same should pass on the House floor. Representative Neighbors, look forward to hearing it on the floor. All right, thank you. Okay, I see Representative Nemus is in the room for a topic that's no stranger to this committee. It's the freestanding birthing centers. All right, good morning.
Good morning.
Go ahead and have everybody introduce themselves for the record, and we'll get started.
Thank you, Mr. Chairman. Jason Nemus, State Representative, Jefferson, Oldham, Shelby Counties.
Mary Catherine DeLoder, Kentucky Birth Coalition.
Christy Peterson, certified nurse midwife in Kentucky and Tennessee.
You may begin.
Thank you, Mr. Chairman. I'm going to just begin very quickly and then have Ms. DeLoder make some comments, and then we'll answer questions. I wanted to note that this is a bill we've seen a lot of times throughout the interim and also twice through committee. Same bill that we passed out of this committee 18-0 with 2 passes last year. We have, like I said, it's the same bill. However, we are working with some of the hospitals on some amendments that they want. We think that this is a very safe option for women. We are trying to address some of their concerns in particular. And so I will not seek for this to be moved on the floor without a floor amendment that addresses these issues. One is a transfer agreement that we believe will improve things. Distance from the hospital is another one. Clarify that standards that are in the bill that we already have to adhere to are the floor, and that the cabinet could obviously do more. We think that's already in the bill, but we're going to clarify to make sure, because there's some disagreement about that. And then to talk about professional insurance, and so like malpractice insurance. So we're going to make those changes. We've been working with St. Nees and some other folks on those things. We think it's already a very safe bill. It's already good in and of itself, but we think those are some improvements that we can make with our friends who heretofore opposed the bill. And so I wanted to mention that as well, that will be coming by way of a floor amendment, and hopefully we can get the language where everybody can agree to it. So with that, I'm going to ask Ms. DeLoder to have some comments, and then we'll answer any questions that you guys might have.
Thank you. Thank you, Chairman Cook and committee members. I want to give a recap about the subject matter, and then I want to talk about some things that are different in the bill this year than the bill that this committee passed out last year. Freestanding birth centers are small, licensed, regulated healthcare facilities which are separate from a hospital where a woman can go to have a physiologic birth, which some would call a natural birth. Care is provided in the midwifery and wellness model and guided by principles of prevention, sensitivity, safety, appropriate medical intervention, and cost effectiveness. It's not a new concept in Kentucky. We already have administrative regulations for the licensing of these facilities and regulations for Medicaid reimbursement of these facilities. But as you've heard before in the past, Kentucky is one of only 8 states that do not have any freestanding birth centers. Kentucky families want access to these freestanding birth centers, and we already have families who are going across state lines to places like Kentucky and Tennessee where there are birth centers available. House Bill 199 would support a renewed evolution of freestanding birth centers in Kentucky by clarifying that freestanding birth centers are not subject to the Certificate of Need requirement. This bill does not alter the Certificate of Need program in any other way. The Certificate of Need does not evaluate safety, so this is not removing any safety mechanism. It's about market share. And in 2018, the legislature passed a bill that exempted 9 different facility types from the Certificate of Need requirement, so there is precedent for such action. Second objective of House Bill 199 is to require the Cabinet for Health and Family Services to update and modernize the existing birth center regulations for licensing. Under this legislation, licensing of a birth center would require that the centers obtain accreditation from the Commission for the Accreditation of Birth Centers. This accreditation is considered the gold standard for birth centers, and it's what is recommended by the American College of Obstetricians and Gynecologists, also known as ACOG. And this has been reinforced by the Kentucky section of ACOG in past statements they have made to Representative Nemes and also in letters they have provided to Representative Nemes in the past. ACOG does not have any other guidelines regarding operation of freestanding birth centers. There are some new sections, particularly Section 1. In Section 1(2)(d), it specifies that the regulations will delineate requirements for medical malpractice insurance for freestanding birth centers. Keep in mind that Kentucky law does not set any requirements for medical malpractice insurance for hospitals or any other type of medical facility, nor does Kentucky law set malpractice insurance requirements for physicians or any other provider type. Section 1(3) puts a limit on the Certificate of Need exemption to 4 beds. So a facility that would have 5 or more beds would still be subject to the Certificate of Need requirement. In the process of updating the existing regulations, the Cabinet for Health and Family Services will have the opportunity to review all requirements for birth centers and adjust them as necessary. And as with all changes to administrative regulations, there will be a public comment period and then review by a legislative committee. Senator Shelley Funke Fromeyer, who is carrying the identical companion bill to this in the Senate, recently met with the Cabinet, and the Cabinet confirmed that they interpret the language in this bill to be the floor and not the ceiling, as you heard Representative Nemes reference, for the licensing requirements. Currently, there are no statutory requirements for licensing of birth centers. It's all in regulation currently. So we see this bill as raising the bar. And as Representative Nemes said, he is committed to a floor amendment that will clarify even further that the requirements in this bill are the floor and not the ceiling for the regulations. Current regulations for birth centers do include several items that have been asked for by the hospitals who oppose this legislation, and nothing in this bill would prevent the Cabinet from continuing to have those items in regulation if that's what they deem to be appropriate when they do the updates. Section 1(2)(c), which is not necessarily new, but I did want to point out, it does specify that a plan must be in place for when a transfer to the hospital is necessary. Section 1(5) is another new section of the bill that reiterates that birth centers do not perform abortions, as they couldn't under Kentucky law, but that is being reiterated here. Sections 3 through 8 are new, and they essentially update language that's used in other areas of KRS where different phrases might be used to reference birth centers. So in some places it might say birthing center, some places it might say freestanding birthing center, and other places there's a term alternative birthing center used. So this updates and makes sure that the same language is used throughout statute. In Section 7, freestanding birthing center is moved from being included in the definition of an ambulatory facility and moved to the definition of facility, which was recommended by the bill drafter. Section 11 changes to add freestanding birth centers to the definition of health facility. And finally, Sections 6, 8, 9, and 10 all make clarifications to various places in statutes to reiterate responsibilities of freestanding birth centers when it comes to items like birth certificates, vital statistics types items, and various testing requirements that are standard for newborns in Kentucky. So those expectations already exist, but we wanted to make that abundantly clear that those also apply to freestanding birth centers. So that concludes the changes to that. And I think that our other presenter is here mainly to answer questions. So I think, Representative Nemes, that's all we have.
Okay, we do have some speakers in opposition to this. Do we have any questions for the pro birthing center group at this time? Okay, and I'm going to let, is there anybody out there that was speaking pro that has not spoken yet that wishes to come forward? Yes, sir. Come on up. Just your name, please, for the record.
All right. So my name is Michael Johnson. I'm Director of Policy for the Family Foundation. Just wanted to share for a few minutes. I appreciate the opportunity, Chairman and committee members. Freestanding birthing centers offer pregnant women another important option and opportunity in choosing the best environment and care for their labor and birthing experience. Don't pregnant mothers deserve to be treated with enough respect and dignity to be given real options and trusted to make informed decisions? After all, these mothers are the ones who are more invested in and have much more at stake in the pregnancy and the birth than anyone else outside the womb. Yet current Kentucky law largely confines a woman's input to her home. Once she leaves the four walls of the home, she is forced to give birth in a hospital where her say on environment and care is greatly limited. My wife and I experienced this firsthand for the last two births of our children. We would have loved to have the opportunity to give birth to our babies in a midwife, with a midwife assisting at a birth center. My wife has had natural births for all four of our kids, and is more comfortable laboring and giving birth in a more home-like environment. But because of current Kentucky law and the lack of choices that exist, my wife was forced to labor and give birth in an environment that is inherently more stressful for her. One negative side effect of this is that it actually incentivizes women to labor in the comfortable environment of home longer and wait longer to go to the hospital. My 4-month-old son actually was born in triage as we arrived at the hospital. Almost didn't make it. So it does increase, I think, the lack of the options and the lack of having that comfortable environment can increase the likelihood of unplanned home births or unplanned births on the way to the hospital. So pregnant women deserve to have a say regarding the setting in which they labor and birth their child. They deserve the opportunity to choose the environment and care that makes them feel supported and reduces stress. They deserve to have a good birthing experience. Allowing women to thoughtfully consider the option of using a freestanding birthing center is a tangible way that the Kentucky General Assembly can treat women with the respect, dignity, and care they deserve. So I urge you to vote in favor of House Bill 199.
Okay, is Miss Oak here, please, with St. Elizabeth? Welcome, good morning. If y'all could just make sure your green light's on and introduce yourself for the record, and then you may proceed.
Good morning, members of the committee. Thank you so much for giving me this time to be here with you today. I'm from St. Elizabeth Healthcare. My name's Dr. Elena Oak. I'm a full-time practicing OB hospitalist and have been practicing obstetrics, delivering babies for 29 years.
I'm Roseanne Niels.
Green light, right in the middle, right here.
Hi, I'm Roseanne Niels. I'm Vice President of Government Relations and Planning for St. Elizabeth Healthcare.
Mr. Chairman, I'm Mark Wilson, a partner at Top Shelf Lobby Counsel, outside contract for St. Elizabeth Healthcare here in Kentucky.
Welcome, the floor is yours.
Thank you. I'd like to thank Representative Nemes and the Kentucky Birth Coalition for working with us on improving this bill and improving safety standards for the women of Kentucky. Just to give you a little bit of a background about myself, I've delivered over 4,000 babies. I've had 3 babies myself, all with a certified nurse midwife, and have had natural childbirth. As a St. Elizabeth employee, I am extremely honored to be part of an organization that supports natural childbirth and supports the practice of midwifery. St. Elizabeth does support freestanding birth centers that follow strict safety guidelines that assure positive outcomes for the mom and the baby. Freestanding birth centers are licensed facilities that have an increased level of obligation to safety. When women choose to have a baby in a freestanding birth center, they are assuming that they are getting a higher level of care and a higher level of experience of practitioner. The current House Bill 199 did offer some of the changes we had recommended with the transfer agreements and the distance from the hospital. But what it did not do is it did not add in the very important presence of an obstetrician or a physician to help oversee and work collaboratively with the midwives that are delivering at the freestanding birth centers. So the current legislation provides that safeguard. The House bill that has been presented would lower the safety standards. As it is right now, it would direct the Cabinet for Health to update the regulations to comply with American Association of Birth Centers. This does not ensure that any physician would have any amount of collaboration or oversight of the women choosing to have their babies at a freestanding birth center. We don't want to give the mothers of Kentucky the idea that they are having a safer birth at a birthing center than they are at home. Some people choose a birth center thinking it's safer than a home birth, okay? And what happens is if there's no regulation and no oversight by experienced providers, physicians, this could be catastrophic. And I just want to point out some differences here around surrounding states. Our neighboring states of Ohio, Tennessee, West Virginia, all require physician involvement. We have a birthing center in Louisville right now that only allows certified nurse midwives in collaboration with physicians to practice there. Our concern that is if the legislature doesn't include these recommendations and let me think the best way to say this. I'm sorry, I'm a little tired. If they don't include the current regulations, that it will be reflective only of the accreditation of birthing centers, we're going to be lowering that safety standard. I do much better if I can answer questions directly and help clarify this. One of the things I want you to understand is the different levels of midwifery care. There are certified professional midwives and there are certified nurse midwives. Certified professional midwives have a significant less in their number of years of medical education and medical training. A certified professional midwife by the current House Bill 199 would be allowed to own and operate a freestanding birth center without any physician collaboration or oversight. We do appreciate that a transfer agreement has been written in, but I have grave concerns about the women of Kentucky thinking they are getting a higher level of care when in exactly, it's not. It's just not a higher level of care if we don't have experts that are available, that can respond, that can advise certified professional midwives on what can deliver at a birth center and what needs to transfer in. I would love to answer questions. I do much better if you ask me some questions and I can explain our stance on this.
Thanks, Dr. Oak.
Yeah.
By my math, that means you deliver a baby about once every 3 days.
I do, and I apologize. I apologize. I'm really tired. I've been on call a lot over the last weekend and delivered a lot of babies. So found out yesterday and couldn't change my call schedule. So I'm very sleep deprived right now. I'm not my normal, well-organized self in my thoughts.
Well, thank you for being here. We really appreciate it.
Thank you.
And it is an important issue to a lot of Kentuckians. So where are we with, I know Representative Nemes was talking about an amendment that's coming. Does that bring us closer together here?
It does. It does bring us closer together, and we're very grateful for that. There were 5 points that I think that maybe you all have been updated on, that Kentucky Hospital Association, St. Elizabeth, as well physicians, midwives across the state. I work with 9 midwives, all of which are in agreement with these 5 requirements that we've asked for. The ones that have been worked on closely is transfer agreement and is it distance to hospital, distance to a hospital for emergent situations. Things that we would like to see are incorporated, are collaboration and oversight by a physician and obstetrician. And that is the main one.
And we've got, that's going to be in the amendment, right,
No,
Representative?
it's not
that's
right now. No. And here's the reason why. Okay. The reason it's not there, and I say this with my hand over my heart because I work with a lot of certified professional midwives, CPMs. They are licensed midwives. I take all the home birth transfers. I did a beautiful home birth transfer just this past week from a certified professional midwife, okay? However, certified professional midwives are very different than certified nurse midwives. And the reason that the Kentucky Birth Coalition does not want the oversight by an obstetrician or physician in this bill is that it would limit the practice of certified professional midwives, because you're going to have a hard time finding physicians that want to provide obstetrical backup in the state of Kentucky for a lower level midwife. And I don't mean that in a bad way. I mean in a less educated, less experience in their training.
Okay.
Does that make sense?
It does.
Okay.
And if I could say, Mr. Chairman, too, we are working in good faith with Representative Nemes to come up with some common ground and consensus on all 5 points. And we appreciate his wanting to refrain from bringing it to the floor until such a time as we're got consensus.
What were the next? We had transfer, we had collaboration. What were their next 3 points?
Let's see. There they are. They kind of go right there. Sorry. Skip over this one. Being close to a hospital so that when a complication arises, the transport time is short, so that the baby and mom have a chance of survival and better outcomes. Following the American College of Obstetrician and Gynecology criteria versus the AABC criteria. It's different. It's more lax with the AABC standard. And one example is that C-section, a woman that has had a C-section, there is allowed under AABC guidelines to deliver at a freestanding center, and these are a VBAC, a vaginal birth after C-section, is a risky procedure. And then the last area was requiring malpractice insurance of the individuals, not just the center. And our doctors are all, and midwives all have malpractice insurance, so I think that's a standard of practice.
Representative, why don't you pull up a chair and come up here? We've got a couple questions, and I think it'd just help if we had everybody at the table to talk about it. So let's start with Representative Bratcher.
Yes, ma'am, thank you for what you do. But Kentucky is one of 8 states without these. I mean, is there some great movement across the other states to get rid of them?
I don't
Are you familiar with the national trend?
They are closing left and right, especially in poor states. We have to look at the health of Kentuckians. It's not good. So to have a completely low risk birth, you know what we call that on my service? We call it a unicorn, because that patient is a magical creature. Because to find people that are truly low risk in the state of Kentucky is very difficult sometimes. So it's just best served by a certified nurse midwife with oversight from a physician, so you can risk in and risk out who is appropriate.
So you're saying other states are closing these down?
Some are, yeah. Alabama. I read a recent article about Alabama closing a birthing center, and
a birthing center, but not
but all birthing centers.
No,
there's going to be bad actors in everything.
Correct.
Every
Correct.
industry.
Absolutely. Things that we do know is that when we look at the choice of where to have your birth, we're dealing with 2 patients here, right? We're dealing with a mom and a baby. Okay, and it is the mother's choice on where to have her birth. but the baby gets no choice. And we know that babies that are born outside of the hospital, outside of regulated birthing centers, have higher rates of neonatal mortality. That is what I see coming in from home as a practicing obstetrician in the state of Kentucky. I've been doing this a long time. I am not here to speak out against home birth at all. Home birth is safe in the right population. Birthing center birth is beautiful. I would hope that someday St. Elizabeth would build a birthing center for our midwives, but there needs to be a safety net for the patients. They don't know what they don't know.
Okay, Representative Nemes, you want to respond to any of that, and then we'll go to.
Well, yeah, these are safe environments, as Representative Bratcher said. They're in 43 states, and I think women can be trusted with their own decision. I don't think we have to act like they can't make a decision on their own. So we have to funnel them all to hospitals. It's great if they have a hospital. We had all three boys, our boys, at hospitals, but to say that they don't know what's best for them, I think I just don't agree with that. I think we do have a response to because they're the 5 suggestions that were made, proposals. We've agreed with 4 of them. We're going to get the language right, but those were easy. But the one that we couldn't agree with was to allow the OB to effectively control the birthing center. We don't think that's required, and that's the one we don't agree with.
Can I speak to that?
I think she's going to speak to that first.
Okay.
Sure.
Yeah, so thank you. You have great questions. I think across the nation, our statistics and birth centers that are at the CABC accreditation standards, using AABC standards for birth centers, speak for themselves, showing increased safety outcomes, reduced C-sections, and reduced NICU needs. And so those statistics are not specific to physician supervision. Those statistics are specific to birth centers who are practicing according to the AABC standards for birth centers. And so that is why we want to raise the bar in across the nation. CPMs and CNMs are both recognized providers in freestanding birth centers. What we know is that states who write in supervisory language don't have safer outcomes. They just have fewer birth centers because the same people who oppose the bill then turn around and have control over who can open a birth center. It is very difficult as an out-of-hospital provider to find supervision from people who are going to be your competitors, not because they don't support what we do, but it can create a restriction of trade. So I think that if you look at the statistics from freestanding birth centers who are at the level of these standards, you'll find that it shows safe outcomes that are meeting the triple aim.
Okay. We've got another question. We have to vote on this pretty quick because we
Okay.
lose the room here in about 10 minutes. So Representative Flannery.
I'd like to, state my concern on freestanding birthing centers, and then ask the doctor whether or not the proposed changes might help alleviate my concerns. My concern on these is that, obviously, as you know, during the birthing process, the baby can malpresent or be malpositioned, and that requires surgical intervention. To my knowledge, a midwife cannot participate in any surgical intervention. Time can be very critical in those situations. Would the transfer agreement or location of the associated, hospital or medical facility help maybe improve those situations when time is very important?
Absolutely. Time is essential. There are ACOG guidelines on when you need to be able to perform a cesarean at the time that it's deemed necessary. The safety of the birth centers and what is it, Christy? It's nice to meet you. I've been on some Zoom meetings or team meetings. I can also show you data that shows terrible outcomes for birthing centers. So I think we need to be very careful when we just say one study says this, one study shows that. What we do need to focus on is exactly what you're saying. What is your name, Representative? Flannery, nice to meet you, Representative Flannery. What you're saying, time is of the essence. We need to be able to transport women quickly. We need to be able to risk out patients that are inappropriate. For saying that the women don't know, in answer to what you said, I am not being judgmental of anybody that chooses a home birth or a birthing center birth. What I mean when I say they don't know what they don't know is from personal experience of taking out of hospital transfers. I'm sorry, my mouth's a little dry. And women saying, I had no idea that could happen. I had no idea I could hemorrhage. I had no idea I could get sepsis and end up in liver failure. To be honest with you, that's what I have dealt with all last night, up all night, with a home birth transfer who is very, very sick with liver failure.
All right. I'm sorry.
It's just a personal example that I don't mean it in a way that they're ignorant. I love my home birth population. I love my CPMs that I work with closely that transfer into me appropriately.
Perfect. Thank you, Dr. Oak. Sorry, we're on a timeline, and I still got to get Representative Kulkarni up. So, Nemus, 30 seconds, wrap it up, and then we'll look for a motion.
Okay, yes. What I would say, there's horror stories at home births. There's horror stories in birthing centers. There are horror stories, obviously, in hospitals. Right here in Kentucky, these birthing centers are safe. They're all over the country. They're not in Kentucky. A lot of people all over our communities, I know in my own district, go across the river to go to Indiana to go to home births. So what I would ask for is this. We've passed this bill a number of times. We're making improvements on this. It's already, I believe, safe. These are not standard list facilities. They have to get a license from the cabinet. They have to follow the ACOG standards. And so what I would ask for is that this is a part of the process, to vote for it, to move it through the process, and we'll see where it goes from here. Thank you, Mr. Chairman.
Representative Pfister, you got to be real quick. Motion. Okay, we have a motion on the bill. Is there a second? We have a second by Representative Callaway. Clerk, please call the roll.
Representative Banta.
Pass.
Representative Bratcher.
Yes.
Representative Callaway.
Yes.
Representative Kleins.
Play my boot.
Yes, sir.
Last year I was a pass, and I will say it's harder to pass this year than it was last year, and I want to commend Representative Nemus and his crew for making the changes, but I'll be a pass again this year.
Representative Dixon.
Sway my vote. I'm going to vote yes, but I do look forward to seeing you guys continue to work together and hopefully make those changes to be agreeable on the floor.
Representative Pfister.
Yes.
Representative Flannery.
I'd like to explain my vote.
Briefly.
I'm going to vote yes. It's a very reluctant yes. I've got a lot of concerns about these, but out of respect to the bill sponsor and his willingness to make some changes, I will vote yes to get this out of committee.
Representative Gentry.
Yes.
Representative Heverin.
Yes, Mr. Chairman, quickly explain my vote.
Briefly.
I echo my colleagues' comments. I'm voting yes today. I've always voted yes on this bill, but I do appreciate that you all are willing to work together to make this a better bill for all. Thank you.
Representative Herron.
Yes.
Representative Huff.
Yes.
Representative Jackson.
Pass.
Representative Kulkarni.
Yes.
Representative Meredith.
Yes, ma'am.
Representative Neighbors.
Pass.
Representative Palumbo. Representative Pratt.
Pass.
Representative Smith.
Yes.
Representative Timoney. Chairman Cook.
I'm a yes. Bill passes. I know there's a lot of work to do between here and it ever reaches to the floor, so I appreciate you all continue to work on that and keep us posted how that's going.
We'll do it. Thank you, Mr. Chairman.
Thank you. Okay, Representative Kulkarni, if you'll work your way down. Representative Pfister, Representative Herron, do you all want to make cast votes?
Yes, I want to record a yes for SB 28 and SB 14.
Got it.
Thank
Representative Pfister?
I'd like to have a yes vote on SB 28 and SB.
Thank you very much. Representative Kulkarni, thank you very much for your patience. I am so sorry. I thought we could get this done, but we've heard this before last year.
We have, and
So-
hopefully this will be a very brief.
Brief review.
That's right.
So thank you all. Introduce yourselves for the record and we'll get started.
Thank you. I'm State Representative Nima Kulkarni, 40th Legislative District.
And I'm Kate Shanks, Senior Vice President of Public Affairs for the Kentucky Chamber.
You may begin.
Thank you, Chairman and members of the committee. This is a resolution that should be familiar with everybody. We actually passed it out of committee unanimously last session, and we heard it the interim before. It is a resolution that would establish a task force to study historically untapped workforce populations in Kentucky, which would include veterans, individuals with disabilities, seniors, those who speak English as a second language, youth, seniors, anybody that is currently either unemployed or underemployed in our Commonwealth, and we would identify the. Thank you.
I'll just say this: big fan. And co-sponsored this with Representative Cole Carney, and I always go back to Afghanistan and a guy that I met over there and ended up moving over here, and he was driving a taxi cab in D.C. and I think he was actually a doctor over in Afghanistan. It's a complete waste of talent, and I think we definitely have to dive deep into this and figure this out. So, Clerk, please call the roll.
Representative Banta.
Yes.
Representative Bratcher.
Yes.
Representative Callaway.
Yes.
Representative Kleins.
Yes.
Representative Dixon.
Yes.
Representative Pfister.
Yes.
Representative Flannery. Representative Gentry.
Yes.
Representative Heverin. Representative Herron.
Yes.
Representative Huff.
Yes.
Representative Jackson.
Yes, ma'am.
Representative Kulkarni.
Yes.
Representative Meredith. Representative Neighbors.
Yes.
Representative Palumbo. Representative Pratt.
Yes.
Representative Smith. Representative Timoney. Chairman Cook.
I'm a yes. Bill carries. Same should pass on the House floor.
Thank
you
you
very much. I'll accept the motion for adjournment. In a second. All those in favor signify by saying aye. Aye. We're adjourned.